Now that you have learned manual lymph drainage, exercise, we're going to talk about self-care and risk management, which are also crucial to this treatment. There are certain goals of management that would be wise for you to adopt. These are also good for the general care of your and well-being, whether you have had breast cancer or not. But if you do acquire lymphedema, and if you are post-op, these are things you should avoid and be concerned about so that lymphedema does not occur. First of all is try not to expose yourself to extreme heat or cold, which can be difficult if you enjoy spas and saunas, which in India you're probably not going to do, but if you're traveling and you have the opportunity to sit in a hot tub, please don't. Lymphedema is a state of inflammation, and you don't want to create more heat where heat already exists. Be careful cooking, doing housework, doing gardening, manicures. Anything that can puncture the skin is dangerous because you're allowing bacteria to enter the bloodstream. And the toxicity that is inherent in lymphedema is a breeding ground for bacteria. So once it enters the bloodstream, infection can occur very easily and very rapidly, and you want to avoid this as much as possible. When you go to see your doctor, please remind them that you have lymphedema or that you have had surgery or radiation because you have had breast cancer, and do not allow them to do any blood draws or blood pressure cuffs on that arm. Tell them always to use the other arm, and be very adamant about it because sometimes they will say, oh no, it'll be okay. It is not okay. So take care of yourself that way and be adamant about the fact that they do not touch the affected arm. When doing exercise, make sure that you create a balance, that you do the exercise daily because it's crucial and important to keep range of motion in your arm and in your tissues, especially after surgery. But do not go nuts and do too much exercise so that you ache or that you're real tired. So there's a balance. Rita's exercises show that there's a moderation, and how she has done them is very lovely. She's incorporated some yoga poses into this, yoga stretches, and these are crucial to do. And she has explained why they're important: to stretch the tissue and the muscles, to get the circulation moving. And the exercises also stimulate the collection sites and the lymph vessels to move fluid. So it's important to do them in a certain sequence. The next thing to avoid is insect bites, if at all possible. And I know this is difficult, but be very aware of mosquito bites and use repellent whenever you're outside, if possible. Mosquito bites introduce bacteria into the bloodstream, and again, infection can result. If you have a compression garment, wear it during the day, take it off at night, and always, always wear it when you're traveling. Air travel especially. Do not wear tight jewelry or clothing such as bras, panties, tights. Anything that will leave a compression in the skin is too tight, because what's happening is that it's creating a tourniquet at that site, and the fluid will expand and collect on both sides of the tourniquet, which does not do anything good for your arm and impedes the flow of lymph. Keeping your skin supple and moist is vital, but try to avoid using skincare products that have petrolatum products in them, such as mineral oil, because it collects in the tissue and your immune system and your lymphatic system cannot get rid of it. In Ayurveda, as you know, there are many, many, many kinds of natural emollients that you should use on your skin, remembering always that what you put on your skin, you are eating. because it all absorbs into the tissue. So keep that in mind when using anything on your body. I enjoy a combination of olive, peanut oil, and lanolin if you can get it, or coconut oil or sesame oil with olive oil and peanut oil. All of these oils are natural ingredients that you eat. And so putting them on your skin keeps the skin soft and supple, but it doesn't impede the lymph flow. The best thing in all of this, besides the exercises and your manual lymph drainage, is yoga and meditation. Meditation primarily reduces stress, which supports the immune system. Yoga maintains fluid balance, keeps the circulation and lymph moving, and also reduces stress. So the combination is something you should incorporate into your daily life if possible. Just a few minutes in the morning, a few minutes before you go to bed can do a world of good. So if you do all of these things on a daily basis, and they don't have to take a long time, but you need to be willing to put the time and effort into yourself and into your own care, because there is nothing more important than you.
I'm not just kidding.